Hi, my name is Jenny Maynard. I am a F&P student at the University of Memphis. I will be doing a head-to-toe assessment today. Today is May 29th, 2024. First, I will scan the room, my floor, behind the patient, the walls, the ceilings, my supplies. I will now start my head-to-toe assessment. We will start by doing a head-to-toe assessment on the head, face, neck, anterior, posterior, chest, and lower and upper extremities. I'm going to start by inspecting the head for size, symmetry, and midline position. I'm going to inspect and palpate the patient's head and scalp. I'm going to be looking for hair color, hair distribution, hair texture, palpating for any lesions, masses, tenderness, any depressions or infestations. I'm then going to palpate the temporal arteries. And then I will palpate the lymph nodes, preauricular, postauricular, occipital, tonsillary, submandibular, submental, and anterior cervical, posterior cervical, and supraclavicular. I will assess cranial nerve number 5, which is the trigeminal. I will palpate the masseter muscle and get the patient to clench his jaw. All right, I will. That is the motor function of that. I will now do the sensory function of that nerve. Let me know where you feel me touch.
Right cheek, left cheek, nose, chin, forehead.
Trigeminal nerve is intact. I will now move along and inspect the ear. I'm going to go back, and I'm going to palpate for TMJ, palpating for any subluxation, any crepitus, or tenderness. And then I will move along to the ear. I'm looking at the outer ear. I'm looking for position and symmetry and size. Palpating the tragus and pinna for any masses or tenderness. I'm then going to look at the internal structure, which is the tympanic membrane and the auditory canal. I'm going to make sure that the auditory canal is patent and the tympanic membrane is pearly gray. There is a little bit of copious amount of earwax. The tympanic membrane is pearly gray and auditory canal is clear. All right, I'm going to assess cranial nerve number 8, which is the vestibular. I'm going to assess the hearing. I'm first going to start with the whisper test. I'm going to get the patient to shut this ear for me. And I'm going to whisper a phrase and please repeat it. 1, 2, 3.
1, 2, 3.
Okay, and shut the other ear.
A, B, C.
All right. I'm now going to complete the Weber test. This is testing for lateralization. Let me know if you hear it equally in both ears or in one or the other.
Equally.
All right, now I'm going to do the Rene test, which tests to make sure that air conduction is greater than bone conduction. I'm going to place this on the typhoid process. Let me know if you can feel it and hear it.
Yes.
All right.
Yes. Yeah.
Okay. All right, and so hearing is intact. I am now going to move along to the eyes. I'm going to assess the eyes. I'm going to assess the lashes, the brows, and papillary fissures. I'm gonna inspect the conjunctiva and scoli, looking for discharge, lesions, and looking at the color, any redness. And then I'm going to, I did the eyes, now I'm going to assess and cranial nerve number 2, which is the optic nerve. I'm going to assess for gross acuity vision by doing the Snellen chart. Can you read that bottom line for me?
DEFPOTEC.
Okay, cover one eye.
DEFPOTEC.
And the other eye.
DEFPOTEC.
Okay, I'm going to do central and peripheral vision. Let me know when you see my fingers.
No.
And this side, cover this ear. This side, yeah, the eye.
No.
Okay, and the other.
No.
All right, that's checking peripheral and central vision. The optic nerve is intact. I'm going to move along to cranial nerve number 3, which is the ocular motor. That is testing the consensual pupillary response to light. I'm going to dim the lights. All right, I'm going to make sure that the pupils respond to light equally, and they do. I'm going to turn the light back on. I'm going to test for convergence and accommodation. I'm going to get the patient to stare at the wall right there and follow my finger in and out. Okay, great job. That is intact. I'm now going to do cranial nerve number 4. 3, 4, and 6, which is the ocular motor, 3, and then the tranquillar and the abducens. I'm going to test the conjugate gaze of EONs. Please follow my finger. And that is intact. I'm now going to assess red light reflex and the internal structures of the eyes. I'm going to follow it in, find the red light reflex, and follow. No nicks or wools. And the optic field looks clear. No nicks or wools. All right. I'm then going to assess the nose, making sure that it is a midline position and straight. I'm going to assess olfactory cranial nerve number 1. Can you tell me what you smell?
Orange.
All right. And then can you close? I'm going to check for nasal patency. Can you close one nose and blow, and the other? All right. I'm going to palpate the sinuses, the frontal and maxillary. Any tenderness?
No.
No? Okay. And now I'm going to inspect the mouth. I'm going to look at the lips, teeth. I'm going to get a light. The lips, the teeth. Open your mouth for me. The buccal mucosa, the under the tongue, the roof of the mouth, the palate, the salivary ducts, the posterior pharynx, and stick your tongue all the way out for me, and the tonsils. He does not have tonsils, but if he did, I would grade them at this time. I'm now going to assess cranial nerve number 9 and 10, which is the glottal and the vagus, which I'm going to test that by making the patient say, ah. I'm going to make sure that the soft palate and uvula rise with phonation. I'm now going to get the patient to move the tongue around. I'm going to make sure that the tongue is midline and moves without fasciculations, which is testing cranial nerve number 2, which is the hypoglottal. I am now going to move along and do the neck. I'm going to palpate the trachea. I'm going to palpate the thyroid gland on each. All right. I'm now going to palpate for carotid artery pulsation on each side. All right, I'm gonna auscultate for any carotid bruits. I'm gonna get the patient to hold their breath. Hold your breath for me. Hold your breath. All right. I'm now going to move along and do the posterior chest. I'm gonna get you to turn around for me. All right, I'm going to assess for any respiratory distress, any signs of increased respirations, tachypnea, cyanosis, tripod positioning, nasal flaring, retractions, or any issues breathing, anything like that. I'm going to inspect for any deformities or make sure that it is symmetric. I am going to palpate for chest expansion. Please breathe in for me. All right, I'm going to palpate for tactical firmitus. Say 99.
99, 99, 99, 99, 99, 99.
All right, and then now I'm going to percuss. I'm going to percuss first in the intercostal spaces. Now I'm going to auscultate in between the intercostal space, so alternating from side to side, starting the high and going down into the lung fields. Take a deep breath every time my stethoscope hits you. All right, I'm going to do the sides. Three on the right and two on the left. Take a deep breath. All right, I'm going to do a few other tests on you. I'm going to do agnophony, and every time you feel my stethoscope, say E.
E, 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 E,
Bronchoscopy, say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
I'm going to do whisper petrocraloe. Whisper 1, 2, 3. All right. I'm now going to get the patient to turn around. I'm going to inspect the anterior chest for any deformities and make sure that it's symmetric. I'm going to palpate for tactical firmness, say 99.
99, 99, 99.
And palpate for chest expansion. Take a deep breath. All right, and now I'm going to auscultate the anterior, starting over the scapula. Take a deep breath. Deep breath. Deep breath. All right, now I'm going to move along to the heart. I'm going to auscultate with my diaphragm and my bell. Aortic, second intercostal space. Pulmonic, second intercostal space. Erb's point, third. Tricuspid. And then mitral. And again, aortic, pulmonic, Erb's, tricuspid, pulmonic. All right, and now I'm going to identify and measure the PMI and identify the PMI. I'm then going to listen to the apical pulse for 1 full minute. For the sake of this video, I will measure and do it so it's 84 at a regular rhythm. I am now going to get the patient to lie down. Here I'm going to be assessing for any JVD and jugular pulsation. I'll get you to scoot down. video. Turn to your left and to your right. All right. No JVD or jugular pulsation. I'm now going to inspect for any lifts or highs. I'm going to percuss for any thrills over the aortic, pulmonic, herbs, tricuspid, and mitral. I'm then going to move along, and I'm going to do the auscultation on the side. Aortic, pulmonic, herbs, tricuspid, and mitral. I'm then going to do the with my bell and diaphragm. Aortic, pulmonic, herbs, tricuspid, and mitral. All right. I'm then going to inspect the abdomen for any contour and make sure that it is symmetric. I'm going to auscultate for any bruits with my bell. Aortic, renal, iliac, and femoral. I'm then going to auscultate the vowel sounds. Right upper, right lower, right upper, left upper, left lower. I'm going to percuss over the abdomen. I'm going to palpate for any masses or tenderness. I'm going to palpate the spleen. Can you please breathe in for me? Okay. Liver is not palpated. I'm going to do the liver. And breathe in for me. And liver is not palpated as either. I'm going to get the patient to face towards that way. I'm going to palpate, percuss for CVA tenderness. Any tenderness there?
No.
Okay, you can turn around for me. I'm now going to move to the musculoskeletal section of this exam. I'm going to be assessing the upper extremities. I'm going to be doing assessing the joints of the shoulders, elbows, wrists, and fingers. I'm going to be inspecting and looking for any deformities, swelling, tenderness, nodules, crepitus, making sure that it's so symmetric, no swelling, nothing like that. I'm going to assess the radial pulse and the capillary refill. All right, now we're going to do the range of motion. Follow me. Flexion, extension, hyperextension, abduction, adduction, thumb opposition. We're going to do the wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. And then we're going to do the elbow, flexion, extension, hyperextension. And then we're going to do the shoulders, flexion, extension, hyperextension. Then we're going to do internal fixation, external fixation, and then circumduction. All right, and now I'm going to test the strengths. Can you squeeze my hands? There we go. And can you push in and out, extend and flex, and push up for me? I'm going to check the shoulder. Go ahead and do the shoulder against resistance. That's checking accessory muscle or accessory cranial nerve number 11. I'm now going to move along, and I'm going to do some cerebral alternating movements with my patient. I'm going to get you to do finger opposition. 1, 2, 3, touch with each finger. Then a hand flip flop. And then I'm going to get you to touch my hand with my finger. And this, all right. And then now I'm going to do a sensory test on the upper and lower extremities. Tell me what, close your eyes and tell me what you feel. Soft or
Soft.
Soft?
Soft.
Okay. I'm going to do the vibratory sensation, and let me know if you feel it vibrate.
Yes.
Ulnar prominence.
Yes. Yes.
All right, and now I'm going to do it on the medial meatus.
Yes. Yes.
All right. And so then now I'm going to do the DTR, deep tendon reflexes. I'm going to do the brachioradialis. And then I'm going to do the bicep. And the tricep. Okay, on each side. Hold your hand out. And then bicep. Bicep. And the patellar. Alright, and Achilles. And Basinski's. Alright. And patellar and Basinski's. Alright, so then now we are going to do, we're done with deep tendon reflexes. Now we're going to do assess the lower extremities. I'm going to assess the joints in the hips, knees, the ankles, and feet. I'm going to assess the radial pulse. Not radial, sorry, that's not radial. The dorsal pulse, dorsal PDLs, and the tibial posterior. All right, and then I'm going to assess capillary refill. I'm now going to do the range of motion like we did before, okay? Flexion, do your toes, sorry. Flexion, extension, hyperextension, and then abduction, adduction. All right, then we're going to do your ankles, plantar flexion, dorsiflexion, rotation, eversion, inversion, and rotation. Great job. Okay, and then you're going to do, I'm going to do the strengths. Push against me. And push up. And push up, dorsiflex. Then I'm going to get you to extend your knee. And then hyperflex it. Extend. And push against me. All right, and then I'm going to do your hips. Extend and push against me. All right, so strengths are 5 out of 5 on those joints. Now we are going to get you to stand up. I'm going to do your hips. So flexion, extension, hyperextension, abduction, adduction, circumduction, internal fixation, and external fixation. All right, and then we'll do circumduction. Do that on both sides. Out. Abduction, then do flexion, extension, hyperextension, adduction, abduction, circumduction. All right, and then we're gonna do internal fixation, external fixation, circumduction. Okay, and then we're gonna do your spine. I'm gonna take a look at your spine. I'm gonna get you to curve. I'm gonna look at the spine curvature. Making sure why he's flexed. I'm going to look at the expected curvature, making sure it's aligned, any tenderness, and looking for scoliosis. I'm now going to look at the lumbar spine and going to do the range of motion. So follow me. Turn around towards the camera. Flexion, extension, hyperextension, lateral fixation, and rotation. All right, then we're going to do cervical spine. Rotation. Flexion, extension, hyperextension, rotation, fixation. All right, and then I'm going to get you to do the Romberg. Put your hands out in front of you and walk. Okay, walk normal and walk heel to toe. Hop on one foot. That excludes our exam today.